Pharmacy News. My name is Lauren, and today we're going to talk about a commonly used non-steroidal anti-inflammatory drug, Diclofenac. The NSAID is used in many situations, including the inhibition of intraoperative meiosis during cataract surgery, pain and corneal epithelial defects after photoreactive keratectomy, radial keratotomy, or accidental trauma. On top of that, Diclofenac is used for seasonal allergic conjunctivitis to the eye, pain and inflammation in musculoskeletal disorders and rheumatic diseases, acute gout, actinic keratosis, ankle sprains, epicondylitis, acute exacerbations of pain, ureteric, colic, and postoperative pain such as migraine, fever, or inflammation in the cataract or strabismus surgery. And now here's Professor Tickle with some history on Diclofenac.
Diclofenac was first discovered by C. Begagi, now known as Novartis, in 1973. After being impressed by the success of NSAIDs such as phenylbutazone, mefenamic acid, ibuprofen, and indomethacin, chemists at the Switzerland-based pharmaceutical company began a search for an anti-rheumatic agent, hopefully possessing similar effects. They wanted the molecule to be weakly acidic, have two aromatic rings which were twisted in their orientation to one another. Although receptor modelling was still a very new technology, the researchers postulated this structure was essential for its functionality in the cyclooxygenase receptor site. Having tested more than 200 analogues, Diclofenac came out as the most useful in terms of pharmaceutical properties. Currently, Voltarol are the main manufacturers of Diclofenac, who mainly distribute the drug in gels and patches applied to the skin.
Thank you very much for that, Professor Tickle. If you are prescribed Diclofenac, the dosage forms include 20 and 50 mg tablets, 50 mg dispersible tablets, 75 and 100 mg modified release tablets, 25 and 50 mg gastrointestinal resistant tablets, 75 mg per 2 ml and 75 mg per 3 ml solutions for injection, 0.1% eye drops, 12.5, 25, 50 and 100 mg suppositories, 10 mg transdermal patches, 16 mg per 1 ml liquids, 1.16, 2.32 and 3% gels, and 140 mg medicated plasters. Now here's Dr. Broadhurst to talk about some contraindications, patient care, and some cautions about Diclofenac.
For topical preparations of Diclofenac, patients and their carers are advised to wash their hands after use. Photosensitivity is also related to administration of Diclofenac, so to avoid this, patients are usually advised against excessive exposure of sunlight. However, there are certain previous circumstances for which Diclofenac should not be administered to patients at all. In intravenous use, a history of asthma, suspected cerebrovascular bleeding, hemorrhagic diathesis, as well as cases of hypovolemia and operations with high risk of hemorrhage. Furthermore, the patient should not take Diclofenac if dehydrated. With systemic use, it is advised that a history of gastrointestinal bleeding, ulceration, hemorrhage or perforation, or related with previous use of non-steroidal anti-inflammatory drugs, as well as cerebrovascular disease again, ischemic heart disease, mild to severe heart failure, peripheral arterial disease, and a history of hypersensitivity to aspirin. Diclofenac suppositories should also be avoided in proctitis. With every pharmaceutical use, Diclofenac does come with cautions. Again, with systemic use, it is advised to take care in these circumstances listed: allergic disorders, cardiac impairment, coagulation defects, connective tissue disorders, Crohn's disease, old age, history of cardiac failure, hypertension, left ventricular dysfunction, edema, risk factors for cardiovascular events, and ulcerative colitis. With topical use, avoid contact with eyes, inflamed or broken skin, and mucous membranes. Do not use with occlusive dressings. Topical application of large amounts can also result in systemic effects, which include hypersensitivity and asthma with renal disease, which has also been reported. Long-term use of Diclofenac has been associated with reduced female fertility, which can be reversed on stopping treatment. It is also not generally suitable for children.
Thank you, Dr. Broadhurst. Now here's Dr. Gunn to talk about the pharmacology behind diclofenac.
Diclofenac, like all NSAIDs, works by acting on the cyclooxygenase enzyme in the arachidonic pathway. The primary role of cyclooxygenase is to convert arachidonic acid into prostaglandins, which trigger local inflammation. Diclofenac inhibits both cyclooxygenase 1, which is associated with the adverse effects in the gastrointestinal tract, and cyclooxygenase 2, which is the desired target for inflammation effects. Biochemists have tested the drug and have found that the pKa of diclofenac is 3.99 and the log P to be 4.71. The molecule has a molecular weight of 296.15 grams per mole, and experiments have shown the half-life to be 2 hours.
Thank you for watching, and please be sure to tune in next week for Keele Pharmacy News with next week's drug of diamorphine.